Welcome to the EZLRS Rescue System's product introduction. The purpose of this brief tutorial is to introduce you to the EZLRS Rescue System and provide you with some basic training and tips that will help you reduce back injuries in your department. The statistics for back injuries in EMS are staggering, and many departments are responding with programs to improve ergonomics and introduce engineering solutions to help reduce injuries. Even with that work, 1 in 4 EMS workers will suffer a career-ending back injury during their first 4 years of service. And today, fully 10% of the EMS workforce is out on a lost time injury. Injuries happen for a wide variety of reasons, including poor conditioning or a lack of training, or even the lack of proper tools to do the job properly. One of the most dangerous things EMS workers do every day is lifting heavy patients who are immobilized on a spine board from the ground to a gurney. This lift is biomechanically one of the most difficult in any situation, and it always takes place in what the National Institute of Safety and Health calls the danger zone. That is the area from the ground to just below the knees. In this squat position, proper lifting does not come naturally. We all know that no matter how well trained we are, at 2 o'clock in the morning we forget to lift properly, a phenomenon called gluteal amnesia. And when we lift and twist to put that heavy patient onto a gurney, we're doing one of the most dangerous things for our back: lifting and twisting. We all know you can't always get the gurney as close to your patient as you'd like. In those cases where you have to carry a patient up or down stairs, the upstairs rescuer has to duck walk, bending at the waist. The downstairs rescuer often holds the patient high to keep them level. Both rescuers are in the most dangerous zone for injury. The problem is that there is just no safe or easy way to get a patient who is immobilized on a backboard from the ground to the gurney. As you can see, these two professionals have been well trained to lift properly. But even in this correct lifting position, both rescuers are at risk because the angles of their ankles, knees, hips, and back are all in the most dangerous zone for injury risk. What happens more often, though, is EMS workers are not well trained, or they have biomechanical issues with posture, ankles, or knees. In compensating for these factors, they lift from an even riskier position, like this, placing their back at significant risk for injury. Traditional backboards are the problem, because no matter what their weight capacity is or how they are shaped, you still must lift from the danger zone to get them onto a gurney. Even when you do everything correctly, no matter what you do, the traditional backboard places you at risk for a back injury. We have an answer to this lift problem with the EZLRS Rescue System, because we raise the point of the lift from the ground to a point just below the knees. This completely eliminates the most dangerous part of the lift, and it places you in a more natural position for lifting safely, helping alleviate many of the biomechanical problems many of us experience from injury or age. Independent testing at the Orthopedic Specialty Hospital confirmed that the EZLRS Rescue System eliminated the most dangerous part of the lift and dramatically reduced torque on the lower back during lifting. This is because raising the point of the lift improves the angles, and therefore the stresses experienced by the ankles, knees, hips, and back during the lift. This independent clinical study demonstrated a greater than 50% reduction in torque on the lower back, which will dramatically reduce the potential for injury when lifting by getting you out of the danger zone. The most important part of lifting is to use your head. Think before you lift. No matter what the task, pause for a moment to make sure that both you and your partner are approaching it in the safest possible manner. Lifting properly begins with making sure your feet are in the proper position. Just as you never see a power lifter simply walk up and lift the weight, You should make sure you're in the right position, beginning with your feet. We call this rooting your feet to the floor, making sure your feet are flat and your heels are down. Stand as close as possible to the object being lifted. In the case of the EZ-Lift Rescue System, the handle should be between your knees. We suggest a palm-up grip called the power grip because it helps keep your shoulders back and your back straight. At all times, keep eye contact with your partner. This will ensure you are protecting each other by checking each other, and it will keep you from looking down and loading your back as you lift. Last, as you lift, brace your abdominal wall. This will help support your back as you lift straight up. Whenever possible, use 3 or more people to carry the EZ-Lift Rescue System. When carrying the EZ-Lift Rescue System, make sure you keep your hips forward. Leaning your upper body forward will increase the load on your back. Keep your head up to watch your partner and where you are going. Allow the leading person to stretch the carry. It should almost feel like they're pulling you along. Again, when possible, use 3 or more people to carry patients. Whenever possible, use 3 or more people to carry patients up or down stairs. When carrying an immobilized patient up or down stairs with the EZ-Lift Rescue System, the upstairs rescuer should use the handle in an extended position. The downstairs rescuer should carry the EZ-Lift Rescue System with the handles retracted, like a traditional backboard. This will allow both rescuers to carry with arms and back straight, keeping their hips forward, and will allow you to stay safe while keeping the patient relatively level. If necessary, use the lowest strap around the bottom of the patient's feet as a footrest to allow them to help maintain their position while on the stairs. Every aspect of the EZ-Lift Rescue System was designed for both EMS worker safety and patient comfort. From the retractable handles to best-in-class rigidity in every weight category, the EZ-Lift Rescue System has performance characteristics that beat every other backboard on the market hands down. The EZ-Lift Rescue System comes ready to use out of the box and includes a complete set of extra accessories. All of our accessories are designed to be effective, easy to use, and inexpensive. The headbed is an effective way to comfortably immobilize a patient without the expensive blocks or sticky mess. They're adjustable, comfortable for the patient, and when used properly with the included tape, completely immobilize a patient's head and neck. The strapping systems come with 1 or 2 buckle straps. The 2 buckle strap system has a significant advantage because you can unload a patient in the ER from either side without having a trailing strap to dig out. The knee wedge replaces the towels or pillows you're now using to raise a patient's knees, either for comfort or to make a tall patient fit better. EZ-Lift has a full support staff ready to assist you, including specialists in pre-hospital emergency medicine, emergency room operation, and ergonomics. We love getting your calls and suggestions. EZ-Lift Rescue is also committed to giving back, and we'll give you a $30 credit toward your EZ-Lift Rescue System when you recycle your old backboards, and we'll pay the shipping to get them into the hands of somebody who needs them. Because the only thing worse than not having an EZ-Lift Rescue System is not having a backboard at all. Your EZ-Lift Rescue System will arrive loaded and ready to use right out of the box. Every purchase includes our Think Before You Lift ergonomics training, training posters, and online video training. Specialized ergonomics training is also available to help you get the most out of your back injury reduction program. Thank you for your time and attention.